Well, no insurance company, I mean, at least nowadays, I mean, seeing as how this disease is diagnosed at a very early age, most insurance companies aren't willing to insure somebody because they go with a pre-existing condition, so you don't really, so I imagine most sickle cell patients fall into Medicare or Medicaid insurance.
That's a whole different, medical is a whole different ball of wax.
Right.
A whole different ball of wax. That is another, I could do a whole hour on that. That's a whole different subject than the life insurance. Life insurance, the reason I did business with Larry is because I have 2 Prudential policies. The way I got them, I'm 51. I was born in 1959. It just so happened at that time, they didn't even know really a lot about sickle cell. We had some local African American physicians within the inner city that knew about it. That's how I got diagnosed. But I didn't get diagnosed till I was 5. But my mother, by God's grace of whatever, just being trained that way, she bought a policy, a small $5,000 policy on me when I was born. That is the only reason I have any life insurance. I didn't have as many problems as a kid, but by the time I hit college, it was all over with. They would not let me increase it beyond a certain amount. Like right after I came out of college, I bought a small house and rental property. Prudential let me get another policy to increase, but only to like $25,000. Okay. Then after that, my health just really tanked. I was in and out every month. I was still working full time, but it was by the grace of God. I did that for 27 years. I'm on disability just of last year now. But after that, in my early 20s, they would never increase it again. The only other way I've had any life insurance was with my employer. I worked for Cleveland Clinic in the 80s, so it was under their plan. I worked for UH for 18 years, left there in 06, so I was under their plan. I worked for a litigation management company, which is making a lot of money, but they're smaller. Their insurance, their life insurance was insuring, everybody in the company, like at the hospital. Right. They denied me. Okay, that's when, See, the smaller the company, the smaller I think it was John Hancock. I've been under some everybody. So they went by my health thing. So even though I was in the company's thing, they denied me. I could not get any disability. I had disability through the hospital. But when I went to the other company, no. I was denied, they had insurance under Cozy. I was denied any disability coverage. I had a broker come to me years ago, because anytime I bought a house, this is my 3rd house, instantly all the stuff comes about, oh, we see you don't have mortgage or disability insurance. And I say, yeah, there's a reason for that. And they're like, oh, I'm sure we can take care of that. And I said, I have sickle cell. Immediately, I hear this dead silence and, I've had one broker that said, I'm going to find something. This was a few years ago. He said, your mortgage needs to be covered. You got a son. He called. He did. I didn't think he was going to call back. He found something, a disability policy. It's over $300 a month.
Wow.
I couldn't afford that.
What about your situation, Larry, for an adult sickle cell?
Well,
Does your company give them a policy?
well, like I say, it goes back to individual. There's certain underwriting that takes place. And depending on your condition and what's taking place in your life, that's how we're able to determine what you qualify for and what you don't. Now, there is other companies that I work with, they call them guaranteed insurability. You're guaranteed insured. Once again, there's restrictions with those. Okay, but at least number 1 is a time restriction, number 2 there's a dollar restriction. Okay, but what I'm finding out is that, they're out there and it's getting better because like you said, patients are living longer, so therefore it's starting to really, take hold to help. But it's a research process that you have to take advantage of. For instance, some of the health questions they may ask is when last time you had a situation where you had to go to the doctor. If it's been several years, then you would fall into that category, and they would say, okay. If it's been 6 months, then they could put you outside that window, and you would get rejected.
How would this health bill affect that, since you can't deny anyone with previous health bill?
That's going to change a lot. One of the things we're finding out right now is because nobody really knows. Okay, you're from the health
Right, that's health insurance.
Right, that's
But he's
different.
talking about life insurance, like I told you,
Well, health needs the
health
life
insurance is a
insurance.
whole nother ball of wax.
Life insurance.
The health reform issue is all about health insurance, that's not life. One reason sickle cell patients, we talk about this in our group when we've had people come in, and Larry will come in and we want you to get cards so you can contact him individually and he can sit down with you and work on your situation. But we talk to our young people about this, that the thing is, and especially if they're having kids, get them insured as soon as possible, if possible, before their first pain crisis. That's why, because we have patients, we have people in our group that a family member died with sickle cell, they gotta go around and collect to get money to bury them. And so that's why we're trying to educate the sickle cell population about that. To get them as soon, like if you just had a kid that has sickle cell, get them then.
Well, the bottom line that if you have an interest in life insurance, you need to talk to Mr. Roberson. Let's get his cards and call him. And he'll talk about the window of opportunity as explained, and there may be a way to help you. That's what he's here for. Is that right, Mr. Roberson? That's what he's here for. All right, we're going to move to our last panelist.
Wait a minute. Y'all have been ignoring this whole back table. These people been raising their hands.
I had a question. I had a question for Mr. Roberson. Okay, say for instance, you go about your business, you get a policy, and you actually don't check off that you have a condition, you have a policy for like 5 years, and then something happens. I mean, you know, you can kind of, is it like an underhand thing, or?
No.
Do that.
No, because what happens is, all of your medical records goes to what they call a medical bureau. Just like they have your credit bureau, there's a medical bureau. So you sign, when you apply for life insurance, you sign off on this form saying that you give us authorization to check your medical history. And if it's in your medical history, then it will come up.
Okay, but someone told me that, you know, you can get a policy and they won't, say for instance for 10,000, but it won't be a full policy, it'll be for so much, for so many years, and if you happen to go on and on, then it'll become a
Right.
full policy.
Some of those policies that you see on TV, a lot of times, and I have access to them also, there's a 2-year period in there that they can give you back your money. If you die within 2 years, what they basically do is just give you back your money, and your policy doesn't really come in effect until after that 2-year period. Because in insurance anyway, there's what they call a 2-year incontestability period, which means even if you say something on something get missed, if you was a smoker, for instance, and it wasn't detected that you was a smoker for the first 2 years, and then all of a sudden, after those 2 years, they find out you was a smoker, there's still nothing the insurance company can do. So in the first 2 years, if you live within the first 2 years, going into the 3rd year, now you have full coverage.
Okay.